Leah's a great speaker. It's a lot of good work in this particular area. So hopefully, as I say, you'll find this beneficial as well. It is the first of a bunch of events that we're going to be doing throughout the year. So please do keep an eye on your email inboxes, so we can alert you to the different things that are happening here at Piota. So this is Learning Lunch. We'll kind of get started now. So I'm just going to do a quick intro. My name's Chris Elkin. I'm the head of healthcare at Piota. Some of you may or may not have heard of Piota, I don't know, but I'm just going to give you a quick overview of who we are before I pass over to our guest speaker, Leah. So let me start this. So who is Piota? We're a leading provider of patient support apps to the NHS. And what does that mean? Well, we have over 120 NHS and social care clients now, all of which we work with come from different areas within the NHS. So we've got clients, NHS England, Public Health Wales, different trusts, CCGs, ICSs, all the way down to individual teams. In terms of our platform, it's an app platform that we license to our clients. These are all sort of examples of different apps that we've produced. And you can see they're all slightly different, but have a similar kind of look and feel to it. It's a very simple to use, very easy to use solution. And as I say, many teams are using these apps at the moment. This is an app we've got for University Hospitals Birmingham. This is all their paediatric guidelines on an app, quick and easy access. Healthy eating for an app up in Scotland. This is for care home staff. So lots of different apps for lots of different areas within the NHS. In terms of our experience in this particular area, we've got nearly, I think, a dozen or so now different clients that are using our platform for providing their cancer patients with information, valuable sort of information about treatment, about care, about the different services that are available to them. This is a sort of selection of. So what I'm going to do now is hand over to Leah Morgan. Leah has kindly agreed to provide this overview. Leah works as the Cancer Survivor Improvement Facilitator at Shrewsbury and Telford Hospitals, helping support people living with and beyond cancer. She continues to develop the programme and has recently started to develop relationships with primary care and other community sectors. So Leah, if I can hand over to you, I'm just going to get your presentation on my screen now.
Thanks very much. I've turned my camera on, but I don't think that you can see me, which is probably not necessarily a bad thing.
I can see you okay.
Oh, well, in that case, I hope everybody else can as well. So thanks very much for having me. My name is Leah Morgan. I am the Cancer Survivorship Improvement Facilitator, although my job title name has literally just changed in the last week. I am now the Personalised Care and Cancer Improvement Facilitator. And today we're going to be looking at the whole picture of personalised care and basically a little bit more about the programme and the work that I do. So if we could have the next slide, please. So what does it all mean, really? It's around the one size does not fit all. So it helps a range of people, from those with long-term illnesses and complex needs through to people managing mental health issues or struggling with social issues, which can affect their health and well-being. It helps them make decisions about managing their health so that they can live the life they want to based on what matters to them, but working alongside clinical information from the professionals who support them. It just enables them to make those informed decisions about the planning and delivery of their own care. It's a response to that one size doesn't fit all, and the healthcare system, which cannot meet the increase in pressures and the ever-changing needs. Evidence does show that people will actually have a better experience in improved health and well-being as well if they can actively shape their own care and support. It can enable people to have a voice and to be heard in relation to their care, and it can also connect people with their communities and what's happening in the support that's available for them. Next slide, please. So in order to do this, there is something called the Comprehensive Model of Personalised Care, and that's currently being rolled out to embed 6 evidence-based components or programmes with the aim of supporting people to build knowledge, skills and confidence to live as well as possible for as long as possible with their health condition. It also aims to empower people with these more complex needs to have greater choice and control over the care they receive. Now, I could talk for a very long time about this. However, I'm limited on my time, but please do get in contact if you want to talk about a specific a component that you can see on there that you want to know a little bit more about. Please do get in touch with me. But through these standard programs, there is a balance between specifying a national standard as well as enabling that flexibility to meet the more local needs for the people that you may care for. So as you can see, there are those 6 components there. And they all make up and work together to deliver that personalised care. If we could have the next slide, please. So what does that mean for people who are have a cancer diagnosis or who are affected by cancer? Well, we can see there that Macmillan have predicted that by 2040 there's going to be 5.3 million people living with and beyond cancer, and that just kind of really shows and strengthens why personalised care is so important. It enables that person to take an active role in the way that their care and plan is planned and delivered, but it really highlights the importance of working with colleagues across the wider system to deliver that best care for the person living with cancer. It facilitates those conversations around really what matters to them. From a clinical point of view, we have all of our fantastic specialists who look after the proposed pathway for them, but actually for that individual there may be other things going on that they need that support with, and then having the diagnosis of a cancer on top of that can understandably be so overwhelming. So what is important to them? It really highlights the importance of sharing information at the right time for the person living with cancer. So what can we do? So part of my program is to highlight the need for early interventions. So whilst linking in with the community services, so we have things called holistic or health needs assessments and care plans, which I'm going to talk about in a little bit more detail on the next slide. We have treatment summaries, a minimal jargon summary for that patient, ideally at the end of every episode of care, and for those especially who are going onto that self-supported management pathway, who are having the remote surveillance. Cancer care reviews out in primary care, and also health and wellbeing information and support. So these are the interventions that I have been working on either as part of my programme or being really heavily involved with another project in primary care behind those cancer care reviews. And by doing all of these at the right time for the patient, it really is able to deliver that personalised care throughout their pathway and beyond. Next slide, please. So I just wanted to focus, again, I could talk for hours on each of the different elements, but I just wanted to concentrate on one, which we have found from feedback from patients and from staff that has had a really positive impact for their care, and that is the health or the holistic needs assessment and personalised support and care plan. So they're a key intervention of personalised care. They used an assessment tool to identify the needs or concerns of the person living with cancer with a cancer diagnosis. They are completed at time of diagnosis, and then depending on the pathway, depending on the speciality, again, several times throughout the pathway, to identify those needs as they may change. And that includes obviously different types of treatment may come with different kind of challenges or needs of that patient. From this H&A and from identifying what matters to them, you are able to then develop a personalised care and support plan if appropriate. And then what this consists of is any information that you had that discussion around during the assessment, and it will also include any actions to be taken by that person who is having the H&A or by the healthcare professional. It helps people to self-manage their condition, so it empowers them to help continually build their confidence for when they enter that more survivorship or after treatment finishes stage of the pathway. it can really make a big difference to people's experience of care. It helps them realise that their concerns are worthy of consideration, and that they can feel that they can go to their team and talk about those concerns that matter to them. But it also highlights sources that are available for them, not just within the hospital, but out in the community as well. It can give them the confidence to seek help at an earlier stage than they might otherwise have done before the issue had reached more serious proportions. And by supporting people to manage their condition on a day-to-day basis, it should help to minimise the risk of a crisis which could lead to an emergency or unplanned admission. So one of the biggest reasons for people not completing, or one of the biggest concerns for why people would maybe not be able to complete H&As, was time. I think everybody can understand just time is so precious, and there are so many pressures in the NHS. So a study was undertaken in 2021 by the National Cancer Action Team. It actually found that many of the H&A aspects were actually already being completed, but not formally recorded. And one of the biggest things that was developed was this personalised care and support plan to really help that person understand what actions they need to take, as well as what you would be taking. It also found that by looking at the other tasks being undertaken by the CNS team, including a number of admin tasks, and recognising the need for a change in the workforce, it actually identified that across the team, a full 2 days per week on average was spent completing these tasks, which then put out to, well, how can we manage this going forward to be able to enable that personalised care H&As and the plans, which leads on to, if you could go on to the next slide, please, our cancer care support workers, or navigators. We currently have 17 navigators in SATH supporting their clinical teams, and this role can include a number, if not all, of the following. So they are all a point of contact for the patient throughout their pathway. They can pick up the phone if they have a question, and rather than leaving an answer phone message, they can actually speak to somebody on the end of the phone. They can triage calls. They support individuals to take control of their own care. They're able to answer questions and make appropriate referrals. They have a wide range of knowledge of services. They support the personalised care agenda and the CNSs, clinical nurse specialists, by completing these H&As and the care plans where appropriate. And they support those on the supported self-management pathway, which includes remote surveillance. They can also support and facilitate patient focus groups, and also the team with other duties when appropriate. But in regards to the H&As, they the majority of the navigators have actually created telephone clinic, which sets aside the specified time to complete the H&As. The letter is sent, and then the call is held. The personalised care plan is developed and sent to the patient within 7 days of the H&A being completed, and also, if the patient is consents, over to the GP practice to really try and strengthen that communication between primary and secondary care. I won't go through the just below that is the escalation. So knowing that one of the biggest things we talk to our navigators around is that it is not all on your shoulders, and that people are there if you feel like you need to escalate any kind of concerns, that they can go to their clinical teams. Next slide, please. So a way of monitoring the personalised care and how people can be affected after having a diagnosis. The Cancer Quality of Life Survey is a national survey run by NHSE. It initially invited patients diagnosed with breast, colorectal and prostate cancer, but following that successful pilot, they've actually now, it's now offered to anybody with a cancer diagnosis 18 months post-diagnosis. Currently, the survey includes questions from 2 well-known and well-tested quality of life questionnaires. The EQ5D questions are used widely across the health service and in medical research. They allow comparisons to be made with people treated for other health conditions or with the general population. And then secondly, the EORTC questions are about cancer in general, and these allow the NHSE to look at differences in quality of life across the different cancer types. The aim of the survey is to find out how quality of life may have changed for people diagnosed with cancer. It will enable NHSE to see where care is working well or not so well, and if any new services are needed. The results from the survey will help improve the way that NHSE support people to live as long and as well as possible. Next slide, please. So in order to deliver the most effective care and to improve patient experience, it's really vital that there's this whole system approach. By working collaboratively, it enables a variety of services across the health, social, public health and community spectrum to be integrated around the individual in order to deliver better outcomes and experiences. It's also led to the creation of a range of new roles, that including the Cancer Care Navigators that I spoke about before, that further improve the quality of care that patients receive. One of the key components of personalised care is social prescribing. It's an approach that connects people to activities, groups, and services in their community to meet the practical, social, and emotional needs that affect their health and well-being. As well as being a referral service that is able to offer people time to focus on the what matters to them approach, it also supports existing community groups to be accessible and sustainable and help people to start new groups working together with local partners. Next slide, please. And if we could play the video. So this is just a brief video that just explains a little bit more about social prescribing.
Many things affect your health and well-being. GPs tell us that a lot of people visit them feeling isolated, lonely, or stressed out by work, money, and housing problems. These are issues that can't be fixed by doctors and medicine alone. At its most basic, a social prescription offers the kind of help that doesn't come in a tube or a bottle. The idea behind social prescribing is to help you to have more control over your healthcare and find ways to manage your needs in a way that suits you. There are lots of different ways of providing social prescribing services. It often starts with a conversation, perhaps with a link worker, a support broker, or a community navigator. Whatever they are called, they are there to listen to you and put you in touch with whatever it is you might need in order to feel better. That might mean being introduced to a community group, a new activity, or a local club. It could be legal advice, volunteers to help around the house. It might just be information and guidance, a bit of inside knowledge on your situation and what local resources there are available. It could even be some support in how to create something new. Studies show that individuals with social prescriptions get better and feel better faster than those treated with medicine alone. And because it works, it's happening more and more. To find out how it can work for you, talk to your doctor, health professional, or local authority today.
So in response to feedback received as part of the national surveys, our hospital, our trust, responded by creating direct referrals into the social prescribing team. The feedback was there was limited coordination between the services and support offered by the health and voluntary sectors, which contributes to poor cancer patient experience. So by creating this direct referral into the social prescribing team, we've hopefully been able to rectify that a little bit. We have just done Shropshire and Telford and Wrekin, and we have just also extended this to support our POWERS patients who are also treated within our hospital as well, creating that more care closer to home approach as well. And just next slide, please. So as the digital era continues to grow, we made the decision to offer an app offering 24/7 information about the hospitals, the Living With and Beyond Cancer programme, the teams, the treatments they may come across when visiting the hospital, as well as services available in their local community. At the moment, the app was launched in July, and at the moment it currently has 415 users and has had over 41,500 user interactions. It's for anybody affected by cancer. It's free to download, and it is also used for those supporting people by cancer as a resource for local knowledge. The foundations of the app were created by Toyota Healthcare, and the content has been created in collaboration with people living with cancer, local NHS specialists, colleagues in primary care, and other services and organisations within the third sector and wider community. The app is a part of personalised care in its own right, empowering people with information at the right time for them. And next slide. Thank you very much for listening. It was a very brief stop of personalised care. So if you do want to talk to me about my programme or personalised care in general, please do just get in touch. Thanks very much.
Thank you, Leah. That was absolutely brilliant. So we're just going to continue on for a couple of more minutes, and then what we'll do is we'll give people the ability to ask questions, if that's okay. So I'm just going to just create this. Right, okay, so just to carry on from that then, let's have a quick look at the app in a bit more sort of detail. As Leah said, it provides a essential resource for patients, but not just patients, families and carers, you know, the people sort of supporting the patient that need access to these different informations, these different groups. So this is one of our apps. It's got a news section that brings in lots of sort of Twitter feeds and local news. What we're trying to produce here is a bit of a one-stop shop, a bit of a safe place where, as I say, patients, families and carers can pick up their device and then sort of navigate through the app and find information relevant to them, their area, their treatment. This one is about the different teams that are available. So again, you know, you can come onto the app and get information about the people that are looking after you, how to contact them. There's a contacts directory. You can sort of navigate through the directory. You can press one of those buttons and it will take you through to the extension number. It's all been designed to be very quick and easy, very, very simple to use, simple to navigate. So people are going to say, can pick this up within a couple of clicks. They can be speaking to or contacting the relevant persons. We have a calendar, or I should say, Leah's team have a calendar with all of the sessions that are available within the community. Clicking onto these events will give you more information, how to register, how to go and join. And again, it's all about sort of promoting the community and the services that are available. Leah touched on social prescribing. As again, if you can sort of integrate yourself into these different resources, these different things that are available to you, you know, that can certainly help with your recovery. This is a simple page with information and graphics on there. Within the app itself, we've got the ability to be able to translate. So within the app itself, we can click on the translate button and then translate that into over 100 different languages. So if you've got a sort of a fairly diverse community with a bit of instruction, patients, families and carers can download the app and then translate that into their native language, making it sort of easier again for them. This is a really great section. So again, it's all about services that are available to people. You can navigate down in alphabetical order and then go and find those services that are available and contact them relatively quickly. All the hyperlinks will take you through to phone numbers, take you through to email addresses, and just make it really, really simple for you. And that's the idea, I think, isn't it? You know, make it simple for people, and they're more likely to you know, to do something about it, more likely to take action. This again, you know, there's a big section there about finance and prescriptions and, you know, what the benefits and services are available to you. It all comes back to that sort of one-stop shop. You know, everything's on the app, everything's that you need. So just quickly before we finish off, just a little bit about the Toyota app solution. It comes in two parts. We license you the platform. As I say, we've been around for about 5 years now within the NHS, got 100 odd different clients, but we work with you to understand what you're trying to do, and then we can customise the app to meet your particular requirements. On the left is our content management system. That is a platform where somebody within your team will start to create and deploy the content. So, you know, we're not the subject matter experts here. We're licensing you a platform for you to go away and create and manage your own content yourselves. Really quick and easy to use, a simple editing tool, simple functions. And again, it's been designed that way. It's been designed to be easy to use for your patients, families and carers, but similarly easy for, you know, your administrators to be able to pick up and create and deploy content, you know, literally within minutes. What does the app process look like? Well, if you are interested, then obviously reach out and we can have an initial meeting online, Teams, Google Hangouts, something like that. We can talk about what it is you're trying to achieve, what are your challenges. There's a good chance that we've done something similar with another organisation, so we can demonstrate what other people are doing within your particular area. But then we can go on, if appropriate, to produce you a free trial. This is a 30-day trial. There's no costs associated with it. Anything that we need is just a little bit of your time in order to understand what it is that you're looking to achieve, in order that we can produce a trial that can tell your story. Once we've produced the trial, as I say, it's 30 days, you can then start to demonstrate that with your patients, families, carers, to your staff, to your colleagues. You've got the ability to download it, to start using it, to get familiar with how it all works. Once you're ready to go, we can take you through the sort of procurement process, work with your sort of procurement teams or information governance teams to ensure that everything's good to go. And then it's about launching the app or kicking off the app, getting the content in there, giving you the training, providing you with the ability and the confidence to be able to produce content relatively quickly. And it's not difficult at all. It really is simple. Just a quick quote from one of our clients. At the start of the pandemic, we had a chief nurse from a CCG, as was, come to us and was desperate to get an app out there to her colleagues within the care homes. We managed it with our platform and with the help of their team to get it rolled out same day. These things don't have to be overly complicated. It doesn't have to be a long drawn out process. The whole ethos behind what we do is about quick and easy. Quick and easy for patients, families and carers most importantly, but quick and easy for you guys to be able to get this thing off the ground and get it out there and start communicating and engaging better with your audiences. What we will do is take some questions from you guys now. Let me just go back onto Teams and see where we are. So if anyone's got any questions, I'm just looking in chat and it doesn't look like we have any questions. Anybody has any questions for either me or Leah before we go? I've got a couple of questions for Leah. I mean, can you provide us with any feedback that you've had from sort of patients, families and carers first and foremost, but then other healthcare professionals that that are helping to or using the app within their areas?
Yeah, absolutely. So especially the community teams, I've had a lot of positive feedback from them because obviously they're out in the community and can be sometimes just on their own with that person who is looking for something specific. So they've used the app as a resource, and I've had several of the my community colleagues say that it's been wonderful, that they've just been able to find the information for them, signpost them to the right person or the right team or service for them to help them with their needs. Which obviously is providing that personalised care, which is just so important. And then from actual patients and family and friends, one of the there's many that stick on my mind, but one that always comes to light is there is a son who lives down in London who actually downloaded the app to understand a little bit better around the hospital and the treatments that his father was going to be receiving at our trust. So actually it's not just being used locally, it's actually being used around the country as well by family members of those who are being treated at our hospital. So I think that speaks volumes as to how crucial it is, and also it means that they were able to get that information that they wanted, which was just a little bit more about what the hospital, where we are, what we do, that kind of thing, and it meant that they were able to get that information without actually having to ring the hospital itself, even though obviously that is always an option. They didn't feel they needed to, so I think that that's really positive as well. Yeah, we've had some really positive feedback.
Excellent, great stuff. Have you got any hints and tips for other organisations that may be thinking about, creating something similar?
Yeah, so I personally, I do most of the content, and so I just wanted to kind of follow on from what you were saying before, Chris, as to how easy it actually is. The first couple of times it obviously takes a bit longer, but that's like anything. But actually now I can easily put together something. As long as I've got the content from whichever team is wanting that content, I can put something together in just a few minutes, and it really is that simple. And the fact that once I click save, it actually goes onto the app straight away is another huge bonus as well. So yeah, any hints and tips I would say is more information the better, but do it in a way that is logical. Don't be afraid to duplicate information in different tiles. We're all different as individual human beings, and we all look for things in different ways. So I would really urge you. We've got a specific program behind several of the different tiles as well. So yeah, that would be my main advice.
Thank you very much. We've got a question from Holly Leach. She's saying the Macmillan app, can anyone download that? This isn't necessarily a Macmillan app as such, Holly. This is a dedicated app for Shropshire and Telford Hospitals Cancer Services. But yes, you can download it. Anybody can download that particular app. If you go onto the App Store and search for an app called My Health Boost, once you've installed and downloaded My Health Boost, search for SAF Cancer Services, and you will see, or you'll be able to download the app directly onto your device, have a little nosy around and see what's happening. It's all good stuff. I'm sure Leah won't mind you having a little look.
And please feel free to get in touch with me as well. I can always help you download that app as well. And we work really closely with our Macmillan colleagues over in the Information Support Centre, and we have a lot of information linking to their services and the resources that Macmillan provide as well. It's a huge part of the service of that whole system approaches that I was talking about before.
Right, I'm just going to time in. We're 1 o'clock. We're really slightly over. Leah, thanks ever so much for helping us out today. We really appreciate your time and expertise. It's just been great. Thank you again. And everybody else, thank you for your attending today. I understand you're all very busy with work at the moment, and we do appreciate your time. Thank you for registering. Thank you for coming to see us. We will be back in contact with you relatively soon with a video of today's session. So if you want to share that with some of your colleagues that perhaps couldn't make it or would benefit from seeing this, then please do. And please remember, we're talking specifically about cancer today, but these apps lend themselves well to a number of different conditions, whether it be patient apps or internal apps. So please do share this with others, and we'll be in contact again with everybody soon. Thanks very much, everybody. Have a great rest of your Tuesday, and hopefully our paths will cross again. Thanks very much. Bye now.
Thanks. Bye-bye.